The Food and Drug Administration, the FDA, the Center for Disease Control and Prevention, the CDC, they've completed their independent scientific review. And based on that review, the majority of Americans who were fully vaccinated with the Pfizer vaccine are now able to receive the booster shot 6 months after they've received their second shot. 6 months after you receive the second shot, you're eligible. Those eligible include, in addition to meeting the requirement of 6 months after the second shot, those people that are 65 years or older, adults 18 and over with certain underlying health conditions like diabetes and obesity, and those who are at increased risk of COVID-19 because of where they work or where they live, like healthcare workers, teachers, grocery store workers. That group makes up 60 million Americans who are now eligible for a booster with 6 months after their second shot. So, my message today is this. If you've got the Pfizer vaccine, if you got the Pfizer vaccine in January, February, or March of this year, and you're over 65 years of age, go get the booster. Or if you're have a medical condition like diabetes, or you're a frontline worker like a healthcare worker or a teacher, you can get a free booster now. I'll be getting my booster shot. It's hard to acknowledge I'm over 65, but I'll be getting my booster shot. It's a bear, isn't it? I tell you, acknowledge. Anyway, but all kidding aside, I'll be getting my booster shot. I'm not sure exactly when I'm going to do it, as soon as I can get it done.
Over the past 18 months, we have experienced a deadly pandemic that has had a disproportionate impact on parts of our country. Those on the front lines, in hospitals and classrooms, and those in crowded settings who have put themselves in harm's way on a daily basis. In an effort to protect those at greatest risk, our initial vaccine rollout prioritized these individuals, the everyday heroes of our society. Our healthcare systems are once again at maximum capacity in parts of the country. Our teachers are facing uncertainty as they walk into the classroom, and I must do what I can to preserve the health across our nation. I'm also aware of the disproportionate impact this pandemic has had on racial and ethnic minority communities. Many of our frontline workers, essential workers, and those in congregate settings come from communities that have already been hardest hit. Withholding access for boosters from these people and communities would only worsen the inequities that I have committed to fight. I want to be very clear that I did not overrule an advisory committee. This was I listened to all of the proceedings of the FDA advisory committee and intently listened to this exceptional group of scientists that publicly and very transparently deliberated for hours over some of these very difficult questions and where the science was. After those deliberations, I listened to the votes, I listened to the comments on the votes, and this was a scientific close call. And I think you could tell by the duration of the meeting and the discussions that this was a scientific close call. In that situation, it was my call to make. If I had been in the room, I would have voted yes. And that was yes, how my recommendations came out after listening to all of their scientific deliberations. To the extent that people are concerned about confidence, I would say they should listen to the deliberations themselves. We did it publicly, we did it transparently, and we did it with some of the best scientists in the country.